Here's something that should terrify anyone dealing with office-related pain. Untreated acute pain from poor ergonomics can transform into chronic pain syndrome through a process called central sensitization, and at that point, even correcting the original cause may not resolve the pain. This is one of the most important concepts in pain science that most people don't understand. The mechanism of chronicity involves neuroplastic changes in your nervous system. Repeated pain signals from ongoing poor posture create sensitization in neural pathways. Your central nervous system, your brain and spinal cord, starts amplifying pain signals. You develop allodynia, where normal stimuli that shouldn't hurt become painful. Light touch causes discomfort. You get hyperalgesia, where painful stimuli hurt disproportionately more than they should. And there are actual structural changes visible on brain imaging in chronic pain patients. The transition timeline is important. Acute pain, that's tissue damage and inflammation, typically lasts less than 3 months. Your body can heal from acute injuries if you address the cause and support healing. Chronic pain persists beyond 3 months, and at that point, nervous system changes are often established. The window for prevention is that acute phase, and this is where aggressive intervention matters most. Risk factors for chronification are well established. Poor initial pain management. If your pain isn't adequately controlled early on, you're at higher risk. Catastrophizing, assuming the worst about your pain, creates anxiety that amplifies pain signals. Fear avoidance behaviors, stopping activities because you're afraid of making things worse, actually increases chronicity risk. Inadequate treatment of the underlying cause means ongoing pain signals keep sensitizing your nervous system. And psychosocial stress compounds everything. Prevention strategies should be straightforward, but often aren't implemented. Aggressive early intervention when pain begins. Don't ignore new pain hoping it'll go away on its own. Address both tissue and nervous system components, pain management plus ergonomic correction plus stress reduction. Build psychological resilience, developing healthy coping strategies and avoiding catastrophizing. Correct ergonomics before chronic changes occur. The first few weeks of pain are crucial. When prevention fails and chronic pain develops, the management approach has to change. Acceptance and commitment therapy helps people live meaningful lives despite pain rather than waiting for pain to resolve before living. Pain reprocessing therapy retrains the brain's pain response. Graded exposure gradually reintroduces feared activities. And this is crucial to understand. Structural fixes may not resolve centralized pain because the problem is now in your nervous system, not just the original tissue damage. The insurance and healthcare system barriers are significant. Comprehensive pain management requires multidisciplinary care, but insurance coverage is often inadequate. There's bias toward surgical and pharmaceutical interventions, even though evidence shows behavioral treatments are often more effective for chronic pain. Getting coverage for psychological pain treatment, physical therapy beyond a few sessions, and complementary approaches is difficult and expensive. What frustrates me is how preventable most chronic pain is. If we addressed acute pain aggressively, if we corrected ergonomics early, if we provided comprehensive care in that acute phase, we could prevent the majority of chronic pain cases. But the healthcare system is set up to provide minimal intervention for acute problems and then expensive, often ineffective interventions once pain becomes chronic. The public health implications are enormous. Chronic pain is one of the leading causes of disability globally. The economic costs in healthcare spending, lost productivity, and disability payments are staggering. And individual suffering is immense. Chronic pain destroys quality of life, relationships, careers, mental health. For office workers specifically, the transition from acute to chronic often happens gradually and unnoticed. Your neck hurts, you ignore it. It keeps hurting, you take ibuprofen. Months pass, the pain is constant now, but you're used to it. By the time you seek care, Central sensitization has occurred, and what could have been resolved with ergonomic correction now requires comprehensive chronic pain management. The message here is urgency. New pain is a signal that requires immediate attention and intervention. Don't wait, don't ignore it, don't assume it'll resolve on its own. The first 3 months are critical for preventing chronicity, and aggressive intervention during that window can prevent years of suffering.